Hi my friends, this is Kummer here from the AnatomyShow, and in this video we're going to take a look at fascia rolling for the calf. Tight calves are a common problem that many people ask me about, and here we're going to take a look at why we need to roll it, what happens, and how we can do this in the most efficient way. So fascia rolling or foam rolling or any kind of rolling always aims at, well, actually predominantly acts at and works on the fascia of the body. The fascia is our connective tissue that in layers and sleeves and tubes and membranes builds a three-dimensional version of your body, including your calves. So the idea of foam rolling or fascia rolling is then to mobilize the tissues of your calf again and also reduce pain. So it's increase of mobility or restoring of mobility and decrease of your pain or sensitivity in that area. The need for foam rolling arises through certain activities or movements, or actually the lack thereof. Think of someone or yourselves when you run a lot or you sit a lot. So we have kind of monotonous use where everything in your body moves a certain way and your leg moves a certain way, or when your body is more immobilized. So your leg or your foot just is in one position all day when you sit. That will create a situation either where all the areas, all the tissues of your calf, if we stick with that area, will move simultaneously, more or less contract and move in the same direction at the same time. Or if you're thinking of a more immobilized situation, then all the tissues remain stagnant in that one position. What happens there is that the layers of your fascia, or if you want to just call the muscle layers, they become stuck against each other over time. That can be through dehydration, or it can be through little adhesions, or it can simply be through growing together, so to speak, of prolonged inactivity or simultaneous activation of muscles. That's where we run into problems, because it is in this stuck area that the next movement we make, when they become glued to each other, these layers, the next movement will start to try to pull a little bit. And when we try to pull a little bit and it doesn't go, then we have a tag on the nerve endings that are embedded in your fascia. So when they get pulled without actually moving freely, that's when they signal, ouch. That's where the pain comes from. Yeah? So free movement means no pain. That's one part. Second part is when we try to move more. Areas that are stuck don't want to move easily. That means your overall range, how much you can move, say ankle mobility if you're doing a calf stretch, ankle mobility if you're doing a downward facing dog, will be reduced. So the mobilization of your calves, the fascia of your calves, will help you to regain mobility there. Make sense? Good. Next question is then, well, what are we doing? Yeah? When we roll or mobilize the fascia, you can see I have a whole arrangement of different tools here. We can use actual foam rolls, rather large. We can use smaller, also foam padded rolls. We can use, let's stick with these, massage ball with lots of knobs on it, tennis ball, fascia massage ball. It's kind of hard, solid rubber, or even a rock, or anything else you find in the house. So why do we have all these different tools? And I didn't mention the block. A block can be used as well. I'll show you in a moment how to use this. Each of these will have probably a slightly different effect. So please don't get distracted by what the wind does to my roll here, but also by the tool. Yeah, stick with what you really want to achieve and let your aimed end result, or let your desired result be the guide for your practice. When we're using these rollers, we want to mobilize the fascia, and the tool is secondary. You will notice you get very similar results with different tools, even though there'll be many companies that want to convince you otherwise. Recent research has shown that there is very little, if any, difference between foam rolling and stretching. Interesting, right? So you could do all this without the tools if you knew how to stretch. And here we're talking about active stretching. That means stretching with specific muscles engaged. Different topic, active stretching versus passive stretching, but you can get the same effects from foam rolling or from stretching if done right. No matter how we roll or fascia massage our calves, we're always dealing with three kinds of forces. One would be compression. So if we have one of the tools and we simply have pressure, and so the tissue in your calf is getting compressed. Gravity or extra force by loading up, pressing it down, standing on it, lying on it, bending over to increase that force. That's compression. The other part would be stretching. So if we were now to either roll this part away or roll our leg on this tool or any of the others, we move one part of the fascia, one part of the muscle away from the rest. A little bit of traction, as if it was that. That traction is a stretch. So we're aiming at lengthening the tissues. That is the second part. The third part, or the third type of force, is then sharing, or our sharing forces. Sharing forces are moving layers against each other. This is really where our foam rolling, fascia massaging has the biggest impact. We do want to reestablish that mobility between the different layers. This can be done through various movements. All of these tools will have an effect on it, and I'll show you in a moment how that happens. But before we get to the actual practices, let's just discuss what are our modalities, what are our options for the fascia rolling or the foam rolling. We have, again, three options here. One is very simple, as you already can see, the size of the area that we're trying to address. The larger usually your massage tool is. So this large foam roller here will pressurize or drag or stretch or share a larger area than the smaller objects. Make sense? Smaller areas can be more specific. So if you want to get to a really specific spot, a large roll might not be the best. Make sense? Good. So we have area. The second one is pressure. And there's a lot of debate whether we should use a lot of pressure or little pressure. I think a lot of pressure can be quite painful, particularly if your area that you want to loosen up, and I know about calves being quite sensitive, so unnecessary suffering is the word that comes to mind, or the phrase that comes to mind. This is not needed. Remember, your body, your fascia is constructed in 3 dimensions. These 3 dimensions work depth by depth by depth. They're interlinked, in other words. You start gradually massaging the outside, and that will have repercussions or onward forces, onward effects deeper into your body. Traumatizing your tissues only leads to soreness the next day, and that's what we want to avoid. You need to roll that again. Make sense? Yeah? So, easy does it. Regularity beats intensity. There are some people that work with very specific foam rolling or fascia rolling, say when it comes to scar tissue addressing, and they use sponges. Yeah, very little force, but specific enough to get to the three-dimensional deeper layers in the body. So keep that in mind. Suffering is not needed. If you like it, go ahead, but otherwise you can skip that part. The second part is speed. Should we go fast or should we go slow? Well, it depends what you want. Yeah, you see, we can go really quickly and that will have a more invigorating part. It can have a more mobilizing aspect, more like, hey, let's wake up the tissues. But sometimes that fast, like the faster we go, the more we lose precision. And when we lose precision, then are we getting to the right areas? Where do we want to get to? Do we want to do something superficial on the surface? Do we want to do something deeper? And there the modulation of the speed is wonderful to then guide us into the tissue layers that we do want to address. So we have area, how large an area we want to address at the same time. We have the pressure we want to apply, and we have the speed we want to go at. Let's get to the actual practices when it comes to rolling of your calf. Let's begin with the foam roller that we have here. We could use any of the others, but this might be a little bit more easy to roll without it rolling out of the angle of the camera. These balls can be fantastic to give a little bit of pointed extra stimulation. Just be alert to when you use these for a little bit longer. It leaves these little blotchy dots in your skin, and not everyone is keen to show that off when somebody might be looking at that. Otherwise, any of these tools, including the large foam roll, which just blew away, and could be used for that. Now, simply allowing your body or your leg to rest on the foam roll, on that roll, will have an effect of loosening up these tissues. You could roll on it either by moving your leg, moving the roll, or moving your entire body. You will notice each of those, because we're changing the angle of how these two objects, your foam roll and your leg, or your calf in this case, relate to each other, will have slightly different feels, slightly different effects. Now, notice that I'm turning to the camera for you here. Notice that you can also turn your leg in and out. That now gets you two different muscle groups. Gently, in this case, this gravity-based moving the leg over the foam roller gets me here from the surface muscles, the gastrocnemius muscles, to the edges of the soleus muscles, to the edges of also here my outer abductor group, the perineal group of my muscles that has an influence on the outer ankle stability. So do use your leg all the way around inside as well. Any areas that are specifically painful, be gentle. Remember, your fascia is continuous, so even if you're not directly, let's say, hammering or forcing on the areas that are very sensitive, you're still getting an effect because the overall fascia will become more mobilized. Here's another very interesting one. When you're mobilizing through this fascia massage, this fascia rolling, one leg already, the other leg, which you haven't worked on yet, already will become better, more loose, greater range of mobility and less pain. So that tells us the effects on the nervous system, how your body internally connects to these areas, how your body internally relates and monitors you. Already saying, hey, this is something good, we need this, then tells the other side, you can let go too. let's relax a little bit. Let's wind down that sensitivity on our pain receptors. And all of a sudden, whoa, this is feeling really good. So obviously, I would recommend do both sides to also remove or work on the physical restrictions in the other side. Remember, again, to work all around the leg. Directly rolling on the shin bone, particularly with harder objects, is not really that much fun and doesn't do much for the movement of your fascia there. So this is kind of a rolling to mobilize your calf structure. You can go all the way down to your Achilles tendon. That's part of your calf fascia, and would, by the way, also benefit anyone with plantar fasciitis, soreness, pain at the sole of your foot. That area is connected to your calf all the way back up. You can, when you work with your calf, also work with the area behind the knee and your hamstring area. That is one continuum, and they will all contribute to the tension you feel in the area of your calf. You can see when we work with the calf, this goes all the way across. So we have a broad mobilization of these tissues. There tends to be the point that ongoing pressure on one point, particularly if we use something that actually can bring more pointed pressure. And here, for some people, that might be known as trigger point therapy. You can place let's say this tennis ball just on the sore spot and just allow your body to rest on it. And over time, we hope, and usually it happens, that sensitivity, that knot, which is a physical contraction in that spot of your muscles, will kind of like melt. Yeah? And then all of a sudden, okay, well, it's not that sore anymore, and we can enjoy that, move on to the next area. So pressure rather than speed tends to be more effective for pain. The movement, whether it's through rolling or through the next part I'm going to show you, active movement of your tissues, is more effective for mobility of your calf, ankle, knee, foot continuum. So if now we're taking a look, you could use this, gives me, compared to the tennis ball, a slightly broader effect, so I get a little bit of a bigger area that I can address. Quite nice. Yeah. Or the third option I like to discuss and show you here is really using a block, or you can use any of your rolls. Larger objects usually work better here because we do want to have a slightly larger area of compression. So we again using weight, pressure, to have an area pressed together. So we have this holding of tissue or pushing this tissue into place. That's at this point still passive because we're just allowing my leg, or I'm allowing my leg, to rest on the roll. What I'm adding here, and that makes a difference now, is the active movement of my leg. So you can see I'm flexing and extending my foot. So it's ankle movements. For this to happen, the layers of the muscles in my calf have to glide and slide against each other. So we are kind of fixating or half fixating the surface layer in the calf, and the layers that are slightly deeper to that need to relatively move it. These are our sharing forces. You can do also foot circles, anything like that. Sharing forces to help you mobilize the three-dimensional nature and the depth of how the tissues are interrelated. That will recreate, rebuild the mobility, the range of motion, the ROM, the ROM, whatever you like to call it, of the associated joints. And then you can move to different areas and repeat that. You can do that. You get a little bit of that when you bend your knee, but mostly it's that active use of your muscles while you're fixating part of your body. Many of you might be used to that from deep tissue massage, sports massage, orthopedic massage, any kind of remedial work, deep tissue work through rolfing or similar is following the same ideas. Yeah, so we have the holding in place, we have the rolling and the speed, 4 different effects, and we have the active use of your internal muscles to produce greater sharing movements. And again, we can do that on both sides. Now, if you found this helpful, click subscribe for one. And also check out my courses at AnatomyShow.com, where you can find out more about like where these muscles are, how specifically these continuums are related to each other, how they relate to your posture and your movement practice, whether it's yoga or martial arts or any kind of other sports, running, whatever you might be doing. If you have any questions, leave a note below. Remember to subscribe, and I'll see you in the courses. Thanks for watching.